Hi, Nursing 6818, Dr. Kim Paxton. We're into week number 8. This course is really flying by. So, this week we're going to be talking about complementary and alternative treatment or medicine, along with technology and health, and how we can use these to help prevent, promote, manage, and potentially reverse diseases that people get. This week, for your objectives, you are going to be synthesizing and applying knowledge that you've learned over the last 2 weeks, coupled with new information this week related to complementary and alternative therapies and technology. So for this week, what I'm looking for you to be able to do is to understand, how do you use technology to motivate that patient? How would you use Spark People? How would you use a sugar counting app? How would you use a weight monitoring app? How do you motivate people using technology? The next piece I'm hoping is that you are developing an understanding of how exercise actually is an alternative treatment for chronic disease, for how you can manage it, you can prevent it, and you could potentially even reverse it, depending upon what you prescribe for the patient with respect to exercise. Are you able to define the difference between being overweight and obese and the pathophysiology associated with that state? Can you explain the relationship between diet and exercise to health promotion and prevention of insulin resistance and vascular disease? Now, here you're going to have to tie back into that patho that you've been learning over the last couple weeks and pull it forward. Can you research apps and understand them for their reliability? And how would you actually recommend to a patient an app? And how do you know it's a good app? Do you have to explore it first and understand it, or do you just take the word of somebody else? We're going to be working with this throughout this week's work with relationship to apps, and you'll gain a stronger perspective of that. And the last element I want you to be able to do this week is to understand how complementary and alternative interventions, along with technology, can potentially be used to manage, prevent, and reverse these chronic disease states. Because we have a lot that we're able to do as care providers without turning to drugs, chemicals, to actually have that person become healthy. Remember that with every drug that we take, it is a chemical, and there's always the effect that we're looking for, but the body always has side effects that can occur with these medications that we use. So always keep that in mind. This week you've got a little bit of reading to do. It's not too bad, and the chapters are actually a little bit easier to go through. We've got 2 in Edelman, 1 in Pender. I've got a couple with technology, so you have a really great chapter on technology and how we can actually use it to promote physical activity. Then we have the use of complementary and alternative medication in the United States. This is a website, and it is absolutely phenomenal. There is so much information on this site. It's not a hard read, it's actually a very easy read, but it literally helps to give you that foundation of, how do I use this and how do I prescribe it, and what types of things are complementary and alternative therapies being used for, what kind of patients are actually using them, what type of therapies would I use for X type of a situation. You will probably get onto that site, and you may even want to bookmark it. You can put it as a link on your smartphone. It is a great site that I'm hoping that you'll find as exciting as I did when I got to go in there and start playing around a little bit. And the last article is about an evaluation of, how do I evaluate a mobile application tool or an app, because I have to be able to do that as a care provider before I'm able to actually recommend them to patients. I hear every day about different types of apps that are out there that are really great for patients. And when I actually go explore them and test them out, I find that they're not really all that great. And you guys have been learning that as you work with Spark People. There is recommended reading this week. You don't have to do the recommended reading. There are some really good pieces here that you might just want to tag into and open up. The worst and best rated health apps, I thought was really good. The 2018 ones, when I put this lecture together, we're not all out there yet and not published that I'm able to pull them on a website for you, but they are coming. They'll probably come up in April or May sometime. And then 2 videos. So I'm hoping that you'll find some really good information that you can set foundation with this week's materials. And then you've got a health coaching moment. Is technology the best way to promote health? Now, this video is a little on the controversial side, but I want you to view it because not everybody believes technology is a good way to go. Not everybody believes that social media is something we should be using to actually motivate patients. Not everybody believes that an alternative and complementary therapy is what we should be doing for our patients when we've got a drug we can give them. Take a look at it and let's see what you think. Your CLT this week, you have 3 elements that you're doing. So the first one, I'm going to ask you to go looking at different types of fitness apps that are available. And I want you to pair a health promotion need that you believe is necessary and then pair it with a fitness app of some sort or a health promotion app of some sort. So the process is, first you're going to identify what your health need is, and then you have to explain what that need is and why you chose it to your members. Okay. Then you're going to explore the apps, and then you're going to choose an app that pairs up. So this is share and pair with whatever it is you identified as that need. Okay. Then you've got 4 different things you got to do after you choose it. You got to write a paragraph or 2 about the app and program and how it supports the patient need that you identified. Make sure to include the app and program name, and if there's a URL, include that URL if it's a website or if it's an app on an Apple or a Android type phone. Provide enough information that another CLT member would be able to go and find that app or that website. If you can include a screenshot if you want. You can be as creative as you want about how you do your parent share. As creative as you want. Okay? And remember that pictures really help to draw people into elements that you're trying to explain and teach them about. So I would encourage you to bring forward some kind of a picture with this posting. Then the last piece you're going to do is number 4. I want you to research the validity and reliability of that app or program. Now, if you're not able to find all that specific information about that specific app, okay, with that one there, give me a reflection about general reliability and validity as you learned from reading the article that I'm having you read this week related to that. So there's quite a bit here, but it's all about you going and finding something that connects in with yourself and a need that you identified in either a clinic situation that you've been in right now in practice or something you may have experienced in the hospital setting or maybe something you've experienced as a parent or just as a individual seeking health. And you really want to share that because you found it to be really beneficial. But make sure you tie it in with a need. That's really important to do. So have some fun with this one. It's a little bit different than we've done before, but I think you'll have some fun with this one. The next piece is an individual assignment, and it's called How You View It. You are to choose one of the 4 videos that I've got posted here and watch the video in its entirety. Once you've finished watching the video, I want you to answer 3 questions. 1, you're going to reflect upon the video that you watched. What did you learn from it in a paragraph? Number 2, why is this information important for you as a nurse practitioner to know with respect to health promotion and prevention? That's another paragraph. And number 3, after viewing this chosen video, what would you say to a patient about this topic? And what I'd like you to do is not give me medical jargon or how you would talk to me about this particular video and the content of the video, but how would you talk about it in a literary way with somebody who has maybe a eighth or ninth grade level education, and talk to me that way in that paragraph. And the final thing that you're doing this week is your individual nutrition tracking. So this week we're finishing up with nutrition tracking that is mandatory for the course. So you got your questions here. How did you feel? What were your thoughts? How did you overcome barriers? How would you educate a patient about using this type of program? How did this assignment help you gain real life experience? So some of you were actually doing this before, and I want you to bring forward, for those of you that have been doing this prior to me asking you to do it as a mandatory element of the course, how has engaging in these types of programs changed your life? What element occurred that was a positive component or a negative related to you using whatever program you were using prior to what I told you to do? And what are your thoughts about safety of recommending this type of program to a patient? And then again, don't forget to embed that awesome screenshot. I want to make sure that you guys are getting ready for week number 10. I know we're in week number 8, but at the end of week number 10, you've got a very large paper due. And I really need you guys to get started in putting elements together, because this paper is going to take you some time to write. So this is due week number 10. It is called a Theory and Technology Integration paper. You can begin working on the technology part of it, and the theory part will be coming in the next week or two. So for this particular paper, you are going to be taking some of the elements that you've learned in relationship to nutrition, exercise, technology, alternative and complementary treatments, and pulling it into this paper. Using correct APA format, I'm going to ask you to analyze the literature to identify how health promotion technology can be used to improve the quality of life. How does it support dietary management, address cultural preferences, barriers, technology utilization in healthcare setting communication? So I'm breaking it down into the bullet points. So the top sentence is the big whole mama all put together. So let's break it down into pieces. And you can put this all under literature synthesis. Okay? So the first element is explain how technology can promote achievement of positive health behavior changes and improve quality of life. So that's the first piece, and you'll need to find some type of literature that supports it. The next element, discuss how programs such as Spark People or nutrition tracking or a program similar to Spark People can be utilized to promote independence. And the third one, discuss how programs such as Spark People can be utilized to promote cultural alignment. You will need to have 3 different references for this section. It will come under the heading of Technology and Health Promotion Literacy Perspective. The next element is explain how utilizing a health promotion technologic program can be used to address the needs of diverse client populations. So think about people here in Colorado, people who live in the metro area versus people who live in rural areas. How about a rancher? How about a pro skier? What if you happen to be somebody who is working with one of the wilderness camps? How can all these people use a technological program to help them? You will have to have one reference for this. Number 3, how to use telecommunication technology tools in promoting communication within primary health care. The fourth one, identify an appropriate health promotion theory, which is coming in the next couple weeks. And from that theory, you have to choose the theory, of course, explain the underlying framework and how it supports technology integration as part of the plan. And then from the nurse practitioner perspective, how does this theory embody your role as part of that healthcare team? You'll need at least one reference for that. And then the last thing you're going to be doing is you're going to be conceptualizing that theory and the theory elements into a model of your own making. And what you're going to be doing with this, and this is very similar to what you'll do in your comps, is that you'll take a technological piece. Let's say we take Sport People. And if I use Pender's health promotion model, I will take the elements of what the health promotion model are, and I will input how technology integrates into that model and leads to the outcomes, and how I can use that technology through the model, and it'll lead to a hopefully a positive patient outcome. There is no right or wrong way to put your model together when you draw it out and do the visualization. It's kind of like a concept map. There's really no wrong way, but if you don't do it, or you don't clearly identify the model pieces, so the 5 elements, or let's say you do the trans theoretical model of change and there's 7 stages, and you don't identify the different stages and how technology integrates into each of those stages, the maximum points for this can be a little bit less. You will format the paper. It will be 5 to 6 pages in length. I'm asking you to please stick to 5 to 6 pages. That does not include the reference page or the title page. I need you to be concise in your writing. When you're formatting your paper, the following headings that I have bulleted here will need to be used. Please make sure you are using your 6th edition APA book for your headings. All headings should be flush, left, and bolded. Please remember to put the title on the first page of your paper after your title page. These are elements that I took points off of on the papers the last time, and I really want you guys to get maximum points, so please make sure you're doing that. Your conceptual drawing is going to come at the very end, so I have it here where it's conceptual drawing and the conclusion comes after that. You can draw your conceptual map, you can do a screenshot of it and then embed it on your paper and then do the conclusion after that. It probably will be an entire page. And then don't forget your reference page. If you have questions about this, please don't hesitate to ask me. I am just finishing up the rubric now. I had written it and I didn't like how it looked. I needed to be more clear so you would be able to very clearly see how do you achieve maximum points. I should have that up tomorrow for you to be able to see without any problems. I just wasn't happy with what I'd put together, and I wanted it to be better than what it was. So that'll come up tomorrow for you guys. Remember that this is due week number 10. Questions, make sure you're asking me. The 3 C's of life: choices, chances, and changes. You must make a choice to take a chance or your life will never change. Each of you made the choice to come back to school and to become nurse practitioners. You took a chance, and that chance was being able to engage at the highest level possible, and that you would have the support behind you to be able to achieve that dream, that high level that you're going after. And your life will be changed once you complete this nurse practitioner program. You will never be able to go back to being a nurse that doesn't think at a high level of clinical reasoning, because your brain won't allow you to. Your last motivational quote this week is, I choose to live by choice, not by chance. To make changes, not excuses. To be motivated and not manipulated. To be useful, not used. I choose self-esteem, not self-pity. To listen to my inner voice and not the random opinions of others. Each student in this course is amazing in their own way. I am so glad that I have been part of your journey so far in educating you on health promotion and prevention from the advanced practice perspective. I hope you guys have a great week. I'll be seeing you online. Please make sure you're emailing me any questions you have as you're moving forward on assignments. Have a great week.